You're listening to the Doc Lounge podcast. This is a place for candid conversations with the healthcare industry's top physicians, executives, and thought leaders. This podcast is made possible by Pacific Companies, your trusted advisor in physician recruitment.
Welcome back to the Doc Lounge podcast. I'm your host, Stacey Doyle. Today, we have an incredible guest joining us, someone who has truly transformed the field of hair restoration. Dr. Alan Bauman is a globally recognized expert in hair transplant surgery and hair loss treatment, and the CEO of Bauman Medical, his internationally renowned medical practice. With decades of experience and more than 30,000 patients treated, Dr. Bauman is known for his innovative, science-driven approach that blends both surgical and non-surgical solutions to help patients achieve natural, long-lasting results. At the forefront of hair loss research and the expanding world of biohacking, Dr. Bauman leverages cutting-edge therapies, including stem cell treatments, low-level laser therapy, PRP, and regenerative medicine, all with a personalized, technologically driven approach that sets a new standard for hair health optimization. Today, we're diving into the science, the trends, the myths, and the future of hair restoration with one of the most respected leaders in the field. Let's get into it. Welcome to the podcast, Dr. Bauman.
Well, thanks so much, Stacey. It's great to be here with you.
We're excited to have you. I think that this is a topic that isn't discussed enough, and I know there's so many people that struggle with this. So tell us kind of what are the numbers? How many people are looking to restore their hair and are experience hair loss?
Well, first of all, hair loss is a very prevalent situation that occurs here. In the United States alone, there's nearly 100 million Americans, according to the American Academy of Dermatology and the American Hair Loss Council, who are suffering from some kind of hair-related problem, meaning hair loss or hair thinning. And even though in my practice it's mostly 50-50, that we see 50% men, 50% women, they say that there's about 80 million men out there who are struggling with hair loss and maybe about 40 million women. But I still think it's about 50-50 if you look at across the board, and especially the changes that we've seen in the practice over the past couple of years. And of course, when you have hair loss, the most important thing is that some people can just deal with it, and that's fine and good. But for most, we know it creates a huge decrease in quality of life. So when we're talking QOL, quality of life, we know it can create depression, anxiety. How you look affects how you feel. You cannot separate that. That's we're a species that has learned to groom ourselves. And when you look in the mirror in the morning and you see something that's changing, whether it's a wrinkle or an extra gray hair or a little bit more adipose around the middle, or a thinning or receding hairline, or a shrinking ponytail, that can weigh on your mind. And hair is a very emotional organ in that way.
Well, I appreciate that. And that's why I'm so glad you're on, because I think that this is something that, people don't always talk about, but it really can impact self-esteem. And like you're saying, those things then can lead to depression and all sorts of things. So tell us a little bit about, if you're a physician, what are some early clinical signs of hair loss that they should be looking for to help identify so that they can improve the outcome for their patients?
Sure. And so, for many years, this was called the doorknob discussion in the dermatological circles, because usually a dermatologist would have a discussion about, your skin cancer and things such as that. And then as they're on their way out the door with their hand on the doorknob, the patient would say, "But doc, wait, I got one more question. What about my hair?" And of course, unfortunately, that can turn into an hour-long conversation. And many derms maybe did not want to have that conversation, didn't have therapies or treatments available. So the most important thing is to have some kind of hair question in your intake forms. And this is important because what we've learned over the years, and this is a relatively new concept, because hair follicles are some of the most highly metabolic cell populations in your body, they're a very strong barometer of, you name it, your nutritional status, your stress level, inflammation, and your overall health, and of course, as you age, hair can be a determining sign of advancing age and such. So it's really important to, have that discussion. First of all, don't ignore it in your patients. And of course, if you notice something happening, you want to bring it up. It's your responsibility to identify if someone has a clinical sign. And so for androgenetic alopecia, right, which is common male and female pattern hair loss, it looks different in men and women. In men, it's going to receding hairline and balding or thinning in the crown. For women, it's more of a diffuse loss up front first, although it can eventually recede the temples as well. Most women complain about shedding or a loss of volume. Their ponytail is shrinking. They have to change their hairstyle or their texture is changing. And so sometimes that's a conversation they may have with their hairstylist before they have it with their physician, honestly.
Right.
And when it comes to men, they may not necessarily be in your clinic specifically for a hair loss situation, but in case you notice that they have a hair loss situation, and maybe you're a cosmetic physician or treating something cosmetically, you certainly want to bring it up and identify it because there's a lot of things that we can do today to protect the existing hair, monitor how they respond to various treatments, whether they be in the office or at home, and prevent the need for more aggressive therapies like hair transplantation or reduce the need for transplants over time. So, if there's one thing you're going to take away from this conversation, hopefully, to my colleagues out there, time equals follicles. And that means that the hair follicles don't get better on their own; they're only going to get worse. So, help your patient or your client take some action to preserve their hair if they're concerned about it.
Love that. That's great advice. Now tell us, if you're just a layperson listening in, and I know it sounds like time is very important with this. When should there be an alert for alarm? You talk about, women that they might be shedding. When should you, start to really say, I need to do something about this?
Yes. So the time to do something about your hair is before you need to do something about your hair. And so I've been in my practice almost 30 years. And so I've had the blessing of being able to treat two generations, sometimes three generations of families actually at this point. And I will tell you that our patients from 20 something years ago are now bringing in their children, their daughters and sons to have a hair check measurement, right? And or genetic test to see if they're at risk for hair loss and to get a baseline in and around the time of puberty before hair loss typically will occur. And so, while most men, 20% of men in their 20s have visible signs of hair loss, 30% of men in their 30s have visible signs of loss, and it goes on from there, right? 40% of men in their 40s and so forth. For you to notice that your hair is thinning with the naked eye, science has proven and already shown that you need to lose 50% of your density. So that's why I will say, before it looks thin to the naked eye, that's when we have to take action to preserve, protect, so that we don't have to rely on so much of the restorative therapies. We can do the less invasive, easy peasy stuff first, and then hopefully prevent the need for some more aggressive therapy. But don't worry. I mean, obviously, if you have extensive hair loss, don't be concerned. There's still a lot of things that we can do to get your hair back as it was either 5 or 10 years ago for sure, or even longer. Like my dad was totally bald before we transplanted him. He only had hair on the sides and the back, and luckily he had enough supply to fill up the demand. And today he's super happy with the results that we did over 20 years ago for him, full head of hair. But the point is, to circle back, is that early evaluation is the key. So today, the measurement tools are available to us to not just check hair bundle measurements, cross-sectional area, which is a simple, easy thing to do. It takes 10 minutes, and the device is like, it's like literally this big. It's not a complicated device. And of course, we have also AI-powered microscopes and more advanced tools even than that to track hair density and hair caliber over time.
Wow, that's something I had no idea you guys could do. That's so fascinating. So tell us a little bit, how do you evaluate like the root cause of the hair loss, and how do you come up with the treatment plan for your patients?
Sure. So when patients visit us either here in the practice in Boca Raton, they're coming to the mothership Bauman Medical down here, or seeing us in the office in the New York satellite location, we're going to do a lot of really detailed testing. But many patients also start with a virtual consultation. And so what do we have to work with virtually? Obviously, we can't put a microscope on their scalp, at least not so simple, unless we send it to them. But we're talking first about that lifestyle factors, the epigenetic factors first. Because as I mentioned earlier in our conversation, if you're not taking in enough nutrients and fuel, or you're on a weight loss program, or you're on something for metabolic health, that could affect your hair. If you're on medications for blood pressure, anxiety or depression, or cholesterol, that can affect your hair, and not in a good way. If you've had hormone imbalance, if you have a thyroid imbalance or other hormone changes, whether it be women perimenopause, um, or even during the years of childbearing age, polycystic ovarian syndrome, things like that, that can affect your hair in women for sure. And in men, if they're on special supplementation to, let's say, boost testosterone, or they're using performance enhancing drugs, or they're on a high dose creatine, that can increase the likelihood that they're going to see hereditary hair loss happen sooner. But we talk about those kinds of epigenetic factors first. Oh, and of course, how you style your hair, right? So if you're a woman and you're doing Brazilian blowouts and you could be causing breakage, you're doing a lot of color and these perming chemicals, whatnot, that could cause some breakage too. If you have scalp inflammation, both men and women, many college athletes who are wearing helmets, they have fungal infections under their scalp. Their scalp is so irritated and inflamed, and then they wonder why they're not growing good hair. Um, so there's a lot of factors that can be uncovered. I'm traditionally trained at New York Medical College to be diagnosing patients 85% of the time through history and physical exam, as opposed to ordering a barrage of tests, as we can sometimes get caught up with today. So I spend a lot of time talking about these lifestyle factors to see if there's anything we can pinpoint. And I would say, like, even today, we're post-COVID, but COVID was a big trigger for hair loss, vaccinations as well. And today, I think the prevalent use of the GLP-1 agonists for sure, when you decrease caloric intake due to those medications and decrease the absorption of whatever nutrients and fuel you're taking in, that's going to have an effect on the hair. And sometimes it could be shockingly sudden in terms of shedding and things such as that. So there's a lot of chit chat that goes on before we even put a comb through your hair to look at your scalp and see what's going on in terms of the patterns that we want to identify.
Fascinating. So tell us a little bit about regenerative techniques. I know there's PRP, there's stem cell therapy. What are these all about, and who's a good candidate for these
Sure.
techniques?
So, and this is the reason why we really need to get a significant and serious diagnosis, an accurate diagnosis before we get started with any therapy or treatment. Because if you've got patchy hair loss, that's autoimmune, or you're doing tight braids or pulling or wearing hair extensions and it's causing traction alopecia, that's going to be a different bit of business than if you have male pattern hair loss, or if you have a high hairline to begin with and you want just a lower hairline. Or, we've got to get the right diagnosis, is my point, before we start to think about what kind of interventions we need. And so regenerative therapy is exciting. I mean, regenerative medicine has been a passion of mine for over 15 years. I was one of the first graduates of the Stem Cell Fellowship of the American Academy of Anti-Aging back in, I think it was 2008, something like that. And I actually became a faculty member of that pathway many, many years ago. But we've been using regenerative therapies and treatments as alternatives and adjuncts to more traditional pharmaceutical intervention for over 20 years. And the exciting thing about it is that we now know exactly how to create, for example, PRP, platelet-rich plasma, to trigger hair follicle growth on the scalp. And guess what? To many of my colleagues' surprise, it's different than what you would use for skin or for healing. Right. So skin rejuvenation and skin healing may require a certain concentration of platelets. Well, for scalp rejuvenation and and triggering hair follicle improvements, you're going to need a higher concentration of platelets. So you need a kind of a nuanced preparation protocol in order to make PRP work very, very well. And also understand that the tenets of regenerative medicine include cells, signals, and scaffolds. So if you're using, whether it be stem cell therapy, the signals could be growth factors, could be cytokines, could be small molecules, could be exosomes containing mRNA potentially. And then scaffolds, there could be biologic scaffolds or synthetic scaffolds that are used in combination. And when you understand these three pieces of the puzzle of regenerative medicine, your regenerative treatments are going to be much better. So now that I'll step off my soapbox for a moment, if you have thinner, weaker, wispier hair, and that's visible under the microscope, either with an AI-powered microscope like a Hairmetrics or with a simple dermatoscope, you can see what's going on in those areas. If you have a weak, wispy hair growing in that zone, there's a great chance that we can rejuvenate that using regenerative medicine. So whether it's non-pharmaceutical, low-level laser light therapy, red light, we know exactly how red light works now. which we didn't know in the early days. We have FDA cleared devices for hair regrowth. And guess what? These are not going to be found, the powerful ones are not going to be found on Amazon. So if you're a physician out there and you want to do red light therapy for the scalp, you better get a physician and medical grade, physician grade device on hand that has enough power for scalp rejuvenation and hair growth. And then the therapy I mentioned before, PRP, great treatment. We can also add exosomes to that regimen. We also have transepidermal delivery, which is a way to push growth factors and peptides through the skin using ultrasound, which is a technique called sonophoresis, been around for many, many, many years. And today, really exciting, we have the Follics. Follics is a laser device. It's actually a class 3 laser. It's a fractional laser that is non-ablative, so there's no skin damage, but it creates a heating zone, if you will, under the skin that stimulates hair follicle regrowth. And that's an exciting new tool in our toolbox today. So you can go home with peptides, you can go home with pharmaceutical agents, you can go home with red light therapy. And there's a lot of things that we can do in the office today, from those therapies I just recommended to microneedling and things like that, to get those follicles to rejuvenate and grow thicker, better, and stronger. But you better have the building blocks on board. So you better be well nourished and decrease inflammation at the scalp, and make sure that, your cortisol levels are managed or stress levels are managed and so forth, so that you can regrow good quality, healthy hair.
Okay, it sounds like there's a lot of new technologies that you and your institute they're embracing, and it sounds like really, really helpful for people that have been struggling with, loss of their hair. Are there any, technologies or treatments that you find are overrated that you think gets a lot of hype that should not?
Well, certainly there are things in the pipeline that seem to generate a lot of interest on social media. For example, we always hear about PP405, which is, potentially a very cool molecule that's going to help with mitochondrial stimulation of the hair follicle. But those are in their early clinical phases. We don't have the good solid data. Now, certainly they've done enough studies to gain a lot of traction, and let's just say interest in the general public and also from investors. So that's always a good sign. If you can convince the people who have the capacity to invest in your clinical trials, that's amazing and great. But we really have to see how it works, where the rubber meets the road, which is in the clinic, with people actually using it in real life. Because many times we have a treatment that sounds so amazing and patients are just unable to comply with it, or it causes some other issue that is a problem for compliance or adherence to the treatment. So PP405, very exciting. We've got Veridermics coming out with their sublingual or slow release minoxidil, I should say, which will be interesting if they get an FDA approval there. I think what I'm most concerned about are these TikTok influencers who obviously may be born with a great head of hair, who have yet to experience any hair loss whatsoever, touting the benefits of products that are either completely unproven or just flat out false. I mean, one little study on rosemary oil, and all of a sudden everybody is like, running around like they smell like a leg of lamb. I mean, it's unbelievable. And, I mean, rosemary oil is great. I cook with it all the time. But, I can't tell you that it works as good as minoxidil. I'm not seeing that in the clinic. And it's important for people to know that we see thousands of patients per year, right, at my clinic. And so we really know exactly what's working. And that's not to say that people aren't genetically divergent. Of course they are. And it's often why we do genetic testing to see, hey, how come you didn't respond well to over-the-counter minoxidil? Well, guess what? You have low sulfosyltransferase activity. So your enzyme is not converting minoxidil to minoxidil sulfate, the active metabolite in the skin. And that's why Rogaine didn't work for you. So let's change that to a compounded prescription version. Let's make it a little bit more powerful, make it a little bit more potent, make it a lot more skin friendly, make it hairstyle friendly, and then check it out. Let's see if that works for you. So there's a lot of things that get a lot of bad reputation, like, oh, I got PRP at my local med spa, PS without any anesthesia. Like, why would you do that? Is beyond me. So shame on you. If you're a provider and you're doing a painful PRP, you should probably stop. You should probably learn what to do, or refer a patient to someone in your local area who could perform a high quality, high density PRP process and perform it in a painless way, so that the patient doesn't get so mad or get so stressed that the cortisol negates all of your positive benefit of that PRP that you're using that, by the way, your rep told you would be great for hair, which it is not. So that's kind of, again, I got on that soapbox again, but here's the thing. The treatments can be really, really powerful and great. We want to measure before we start and track your progress over time. It's like you would never get on a blood pressure medication without taking a baseline measurement, or maybe several, perhaps.
Mhm.
And once you start the blood pressure medication, you would monitor for side effects. You'd be in contact with that patient. You bring them back in and check them again, maybe several times, and maybe you need to adjust their medication. And
Mhm.
these are the kinds of protocols and procedures that we need to follow as clinicians in the world of hair loss and hair restoration. If you really want to do right by your patients, it's not a cookbook. If it was a cookbook, the patients wouldn't need a specialist. If neurosurgery was a cookbook, you could just send them to a neurologist and handle everything. But
Mhm.
no, sometimes they need neurosurgery. So if you have a patient who's kind of frustrated, it's time to collaborate with physicians who are board certified in hair restoration, who has made their entire life, dedicated to the treatment of hair loss and changing people's lives. So that's what I would say to my colleagues out there, and to those of you who are doing the right thing, doing the measurements and staying abreast on the techniques and the technology. Bravo, awesome, great job, keep it up, and let's work together to keep changing those patients' lives.
I think that's really insightful for a lot of our audience. I know fellow clinicians are listening, so I appreciate that. And it sounds like, if you get a good referral in your network, you want to do that because someone like you is really an expert that can help and assist from, really a clinical perspective. And you have the experience, you have all the latest technologies within your toolkit. I want to ask you, we're talking about, and I think what I loved about when you in the beginning is you're talking about the timing is right. Make sure you get in before it gets too far gone. And then even if it is, you have lost a lot of hair, there's still options. Tell us what you think, like ongoing maintenance or just keeping, your hair kind of status quo is like. I know there's you were talking about some of the low level laser therapies. What do you think of kind of maintenance and prevention from your standpoint?
Well, maintenance and prevention is critical for anyone who is experiencing hair loss, because hair loss, especially androgenetic alopecia, is a chronic and progressive condition. It gets worse with time without treatment. So once a patient has decided that they want to keep their hair, it's important that they understand that there's a long-term commitment there. Just like maintaining our muscle mass over the course of aging, maintaining our brain function, taking care of our dental health, keeping our skin protected and looking youthful if you choose. Those are all things that require interventions ongoing over time. And even health screening, obviously, you're going to continue to screen yourself for, the things that are going to disrupt and hopefully not end us all, right? So
Mhm.
it's important when someone is coming in with a hair loss problem that they understand that there's no quick fix. And even if we have to transplant an area, let's just say it's a small scar that you got as a child, we can put hair back into the scar. It will grow. It will grow. Those transplanted hairs are permanent, but the hairs around it are at risk. And so if you have male pattern hair loss or female pattern hair loss, and you only do transplantation to fix the problem, you are in a sinking rowboat. And what you're trying to do is bail yourself out without patching the leak. And that's not such a good plan. In fact, for a young man, for example, who's got aggressive male pattern hair loss, if they think that the hair transplant is the end of the journey, well, they're going to be mistaken. And unfortunately, if they don't treat their ongoing hair loss problem, it could become a fool's journey. And what I mean by that is that they'll need much more transplantation over time and probably run out of donor hair, at least scalp donor hair. Maybe they'll have enough beard and body hair to transplant,
Mhm.
but those come with other issues. So it's really, really important. So the ongoing maintenance, first of all, is touching base with the doctor. So our patients come back in every 90 days if they're local. If they're distant, we're going to check in with them virtually every 90 days and see how things are going. If there's a sign or a symptom, where obviously we'd like bring them in for measurements and track how their treatments are going. It could be prescription medication, topical or oral medications at home. Finasteride, minoxidil, could be dutasteride or other non-pharmaceutical agents like peptides and things such as that. They may be doing microneedling at home potentially. They may be using a special type of hair care and scalp care regimen to keep their scalp from being inflamed and their hair looking good. And then when they come in for the measurements, a cross-sectional area measurement, which is called a hair check or cross-sectional bundle measurement, is performed in exactly the same area again and again and again over time so that we can see the trend of what's happening with their hair growth from treatment. And if they're on treatment, we should see a natural improvement in those hair mass measurements until a plateau is reached. And then it should just basically stay in and around that area before drifting down many, many, many years later. So if it's not going that way, then we need to figure out what's happening, what's going on. And, I guess beyond the scope of our conversation today, there are many other types of alopecias that could potentially be going on, from autoimmune to scarring alopecias in women, sometimes even in men. And those need to be identified way up front before you start to begin therapy or treatment. Because you need to know what you're treating. But ongoing therapy, and even PRP, someone gets a PRP treatment, the way that we do it typically lasts for about 10 to 14 months of boost before they have to repeat it. So on the annual, they're going to come back in for that maintenance PRP treatment, either with or without exosomes potentially. But those are the kinds of things that we need to encourage our patients to do over time.
So it's really, I love that approach because it's really ongoing, thinking of it like, your skincare or your, how you would, take care of your body over time. It's really the same that you would apply to hair care as well.
Oh, absolutely. Whether you're in, weight management or hair loss management, you have to start treatment, see how it's going. Any fitness journey, any longevity journey requires you to be cognizant. And, if there's issues, because also your health status could change. You're going from, middle age to perimenopause to menopause as a woman, and there's a lot of changes going on. And oftentimes it's related to your hair. And so if you're seeing changes in hair color and texture, density, coverage, volume, or you're seeing excessive shedding, you got to get on top of things, and you've got to be consistent with the therapies, and you've got to measure them because, hair growth treatments, it's not like Botox. It's not an overnight result.
Mhm.
These things take months to know what's going on. And if you're not measuring and you're just looking in the mirror going, oh, I think it feels better, that's going to take a long time, and you may be wrong, honestly. So the measurements are the key to tracking over time. And that's why we were so keen on doing that, measuring. And we've done, literally 500,000 measurements here in the practice over the past 20 years. So a lot of measurements going on at Bauman Medical.
Well, that's exciting. Well, tell us, I want to just bring this home for our listeners. How did you decide to go into this field? I mean, obviously, this field must be very fulfilling, the specialty that have embraced and seeing how you're impacting people's lives and their overall well-being and just, their happiness. So tell us a little
Yeah.
bit about that for anybody that's, a resident right now.
Yeah, well, for sure. So hair restoration, first of all, is an orphan specialty. There's no direct path to it. And certainly I didn't know a direct path. I didn't even know it existed, to be honest. When I started my journey into the world of medicine, I was mentored by a plastic surgeon. I was intrigued by the surgical skill that he had, the artistry that he used, and the change that he was able to create in his patients' lives. They were so grateful. They were so happy. He was giving them back their youth, giving them back form or function in many cases, when it came to the plastic and reconstructive cases that he did. And I knew that was kind of my path, even going into medical school and then eventually into surgery. So I never went through dermatology. I really learned about hair transplantation from a cosmetic surgery patient who was had a procedure done, and I saw it in his chart, and I just happened to ask him, "Hey, where did you have your hair transplanted?" Because it wasn't obvious to me that he did, and I was expecting to see plugs back at that time, and so he was thrilled that I thought his hair transplant looked natural, and he told me all of the work that he did in the early 1990s to find a surgeon who could do that kind of work to make it look amazing, and I just got the sense that this was something that I didn't know about, and as a resident, you know everything. No, just
Yep.
you know a lot. And even as a someone who was interested in reconstructive and plastic surgery, I didn't think hair transplants were even a viable thing back then. But obviously, the technology was changing, and I was seeing around the corner a little bit because I had spoken to this gentleman who had done a lot of research. And of course, what he had was single follicle implantation, even though he did have the old-fashioned strip scar in the back of his head. I figured this would be interesting to learn. And so, through my training in general surgery, I also spent a little bit of time learning about hair transplantation. And eventually, I did a fellowship, a one on one fellowship with a surgeon because I was in training in New York. I was close to Long Island. I learned about hair transplants and wanted to add that to my repertoire. And when I did that, I really learned that I needed to dedicate my entire focus to this specialty. It was changing so fast. And that was 30 years ago. And even today, it changes so fast. And it's hard to keep up with the innovations in hair restoration. And some of the amazing things coming down the road are just so exciting. But obviously, the things that have intrigued me over the time. And so eventually, obviously, the answer is that I went into the full blown 100% hair restoration practice with really no referral sources, no other experience other than the work I did in that practice for a year. And that was, 28 years ago, in the fall, it was 28 years. And it's been an exciting journey. Today I have a team of 34 people here in my nearly 13,000 square foot facility. We treat thousands of patients per year. We also have an aesthetics division, a scalp treatment department, in addition to our 5 operatories, and certainly doing a lot of regenerative medicine. And even today, it's a very exciting field because we're on the cusp, I think, of understanding how stem cells really work in the world of the hair follicle. In fact, I was just up in Boston a few weeks ago with a researcher, Carl Kohler, who is really one of the few research labs in the world to literally grow skin organoids, which contain hair follicles. And I got a chance to play around and really nerd out, if you will, looking at those follicles under the microscope and chatting with him about how can we make this a viable treatment option, because we certainly don't have hair cloning yet. But there's some new exciting things on the horizon. I banked my hair follicle stem cells a couple of years ago already, and now that company can make a treatment from those hair follicle stem cells. Now it's not a cloned hair follicle yet, but it's the signals from those cultivated cells. So very exciting stuff is happening right now.
It sounds very exciting, and I know that I learned a lot. I'm sure all of our listeners and viewers did as well. So I really want to thank you for your time, Dr. Bauman, and
Oh,
just enlightening us. And I want to give you the opportunity to let anybody that's listening know how they can work with you and your whole team if they
oh.
need, if they want to get an evaluation.
Sure. Well, very often people have a personal need, and of course, we take care of each other. My colleagues in the world of medicine and also aesthetics can visit baumanmedical.com, Bauman medical, all one word, baumanmedical.com. And there's literally uh, thousands and thousands of pages of information, hundreds of hours of videos that people could watch, hundreds and hundreds of before and after photos of all different types of treatments and procedures. If they have a concern or question, they can always go to baumanmedical.com/ask. That's one way to get the information to us. There's a contact form on the site. So even if you just have a simple question, you can send in the information or even just subscribe to my newsletter. We also have a pathway for our colleagues to learn about hair loss and hair restoration. So if you're an esthetician or you're a medical assistant or you're a physician's assistant or a nurse practitioner, especially, or even a physician colleague of mine, you can up your skill set. You could learn what we're doing here at Bauman Medical by taking a class either online or in person at Bauman Institute. BaumanInstitute.com is really the homepage, if you will, for all of this information. I have specific classes on how we do our PRP, how we do our tracking and using the microscope. And there's a lot of different things that we can do. We're, in fact, bringing in a physician from Brazil who's doing some interesting microneedling approaches with medications into the skin for drug delivery and such. So there's really interesting opportunities to really learn the state of the art as it's emerging, because Bauman Medical has become a crossroads for people who are innovators and technology partners, right, who are on the cutting edge of this field. And it's because we test and we try. We have pilot studies ongoing. Some are private. You're not going to know about it until it's all said and done. Many of them are public and registered with clinicaltrials.gov and such. So there are things that are out there no matter what your interest is in terms of hair loss or hair restoration, and of course you can find me on all the social media channels at Dr. Alan Bauman. If you want to send me a direct message, I'm always responsive there as well. But if you're out there with the hair thinning problem, whether you're just starting to see the signs or you feel like it's progressed far enough, you want to take some action. Time equals follicles, as you've learned on this little conversation with Stacey. Please reach out to me. I look forward to helping you.
Thank you so much, Dr. Bauman. And yes, time equals follicles. So everybody be aware and reach out. Well, thank you so much. Such a fascinating episode, and really appreciate your time.
It's my pleasure, Stacey. Thank you so much for having me on. Much gratitude.
Thank you to all of our listeners. If you would like to be notified when new episodes air, make sure to hit that subscribe button. And a big thank you to Pacific Companies. Without you guys, this podcast would not be possible. If you would like to be a guest, please go to www.pacificcompanies.com. Thank you.